Miss Purple, the right mind for any time. I created this podcast to raise the awareness of mental illness. If you have any of these symptoms, notify your physician or call 911. Another suicide hotline is nationwide is 988. Thank you. My name is Deborah Sanders, aka Mrs. Purple. My podcast is The Right Mind for Any Time. Born in Akron, Alabama, but raised in Birmingham, Alabama. I have had 30 years of nursing experience in mental health. First, my career started off as a nurse attendant, an LVN, a RN, a BSN RN, and 2 years of graduate school. I have worked in various institutions in Los Angeles County. I work for the federal government, the county, the private sector. Today, I'm going to expand my information on trying to access mental health care with your insurance from a nursing point of view. 2020, during the height of the COVID pandemic, there was nurses that tried to get access to mental health care and couldn't get it. There's no such thing as comprehensive insurance. Most of the insurance covers med-surg and it doesn't cover psych. Even if you pay cash, it's hard to find a clinician that you can work with for your need at that particular time. And when you do find a clinician, you're going to probably be on a waiting list from 20 to 30 days. During the height of the pandemic, nurses that especially work in ICU and work in the ER, they had PTSD because of the amount of death that came into the area. Some of them had depression, some of them had anxiety. But trying to obtain mental health care within a time frame, it was basically impossible. Also, if your HR, your human resource, have information about mental illness, there can be a stigma against you because nurses are supposed to be strong. They're supposed to carry the burden of their patient, and their burden comes secondary. But with this situation that came on with COVID and all the death that occurred, a lot of nurses had PTSD and a lot of nurses had burnout, and they had no one to turn to. One thing about mental health care, there's more patient than there is clinician out there. So even being a nurse, you have your bearing to burden, especially when COVID came along, for PTSD, for anxiety, depression, and a high rate of burnout. Thank you for listening to my podcast on nurses trying to get access to mental health care. Because at some point, everyone or someone going to need some type of mental health care. My next topic is a tea with the family of people with dementia. First of all, dementia have no color line, no economic status, no nothing. Anyone can get dementia. For example, we had a president of the United States, Ronald Reagan, who had dementia, later went into Alzheimer's. Just the other day, I was reading about very famous Barbara Walters. Now she's at end-stage dementia, or perhaps it may probably be Alzheimer's. But to get back with the family, have a tea talk with them. For example, a neurosurgeon, 70-some years old, has dementia. He was a prominent surgeon, but after he had small strokes, he could not work as a surgeon because the hand was not steady enough. But he still remained at the hospital as in a consulting position. This doctor, on one night of coming home, he never did make it home. His wife alerted the police department and other people trying to look for him. When they finally found him, he was in a totally different town. Dementia can happen to anybody. When dementia does happen, the family need to pull together and talk about it. I'm from Birmingham, Alabama, a small town called Bessemer. In my African-American community in the South, you never even open to talk about dementia. If your grandparents had dementia, they would never use the word dementia. They'll say, your grandma just a little forgetful. I don't know about other race, but dementia and mental illness was never discussed in my household, even though you know the person is acting strange, but you never put mental illness in a framework to talk about in my household. Furthermore, when you want to declare somebody dementia, there are certain workup you have to do. You have to do a mental status exam. You want to do a nutrition status exam. You want to do a EEG, a EMG. And when I discussed with my colleagues, they said now, since people are into all kind of food and metal, you may want to do a metal test. There are really no cure for dementia. Anti-dementia medication can slow down the process. You as a family have to get together and talk whether we're going to put mother in a nursing home or whether we're going to keep mother at home. Whatever you're doing for mother, whether she at home or a nursing home, your primary is for her health and her safety. People that got dementia tend to be up at night trying to wonder how to get out that door to go somewhere, probably nowhere. Sometimes you had to double lock the door. A person that's dealing with dementia, it doesn't start great. It starts as maybe forgetting somewhere you put it at. Then it go into a medium. You get lost going to a simple place. And then you become to the point that you won't be able to take care of yourself. At some time in the family, we're going to have to discuss it, even though your mom or your dad may be married 54 years. To put that burden on one family member to take care of a person with dementia is a big burden to carry. And we having more and more people with dementia now as I reach out and talk to different people due to the fact I think we're living longer. Some people say people getting dementia because of the chemicals in the food or maybe the lack of vitamin. Whatever it may be, dementia is becoming a national pandemic. You may not have it. You may know a relative that may have a friend that have it, or some other sibling. Or your father may have it who's been married to your mom for 54 years. And that is a hard thing to take, that the primary person in the household now got dementia. And as he progresses on, he may not even remember his grandkid. So you as a family had to sit down with a cup of tea and decide how you're going to figure out to care for your parents in a safe and secure way. Thank you for listening to my podcast. Have a good day.